Hi, my name is Michelle. I'm one of the instructors here at Allied. I wanted to welcome you to your CNA class. I want to start this class by giving you a little of my personal history. I've been with Allied for 4 years now. When I first got this job, the first thing I did was look at my CNA certificate. I became a CNA in 1988. And in 1989, I got my medication aid, and then I went to work for Larned State Hospital. In 1990, I became a mental health aide, and in 1991, I became a licensed mental health technician. Is what you needed to give medication at the Larned State Hospital. I worked there for over 4 years, and then my husband got a job in Nebraska. Well, when we moved to Nebraska, I was all excited. I copied all my certifications, all my transcripts from college, and I put it in a big envelope and I sent it to the State Board of Nursing in Nebraska, only to get a letter back that said, you have to take one more class before you could be a CNA. And then I had also gone and applied at a nursing home, and they said they would pay me about a third of what I was making in the state of Kansas. Needless to say, I had 3 babies under the age of 5, and I couldn't afford to work. Literally, I would have paid a lot more for childcare than I would have been making as a CNA. I got pretty down at that point until I met a lady, and she told me about a program called Women in Transition, which is very similar to Workforce here in Kansas. Now, they help pay for your education to retrain you or help you get your degree. With their help, I'm glad to say, I was able to finish my 2-year degree. It only took me 10 years, 3 husbands, 3 kids later. Now, I tell you my story because I haven't always made the best choices. I haven't always done things the easy way. But I'm finally at a point in my life that I can say, okay, those things made me who I am, and I'm okay with it. Now, my first job as an RN, I worked at a rural hospital. If you don't know what that means, we basically did birth to death. Literally, we could be delivering babies. We had 2 surgeons fly in, and they would do operations. And so we would do pre-op, post-op recovery room, circulating nurse, med surge. We had 2 telemetry rooms where we would monitor heart patients. And then we also had a full operating ER. Now, this was so long ago, guys, there weren't cameras. We literally had a doorbell. I mean, the door didn't even have a window in it. So we literally I can remember grabbing my LPN who had been a nurse 3 weeks less than I'd been an RN, and praying all the way to the ER that it wasn't something terrible. One of the funniest nights I had was I went and I opened the door, and here's a guy in handcuffs, and he's got lettuce leaves stuck all over his body. And he's brought in by the sheriff's office, and because one of the things we did was draw the blood alcohol test for the sheriffs and the highway patrol. And I'm kind of ornery. You'll get that through this class, but if you know any of my students, they can vouch for me. But I ended up trying to be very professional, which is hard for me. And the highway patrol or sheriff's office, whichever it was, finally felt sorry for me and said, I pulled him over for a DUI, and he got out of his car, ran, and jumped in the dumpster. And that's why it was covered. And I'm like, oh. So I worked rural nursing. I got homesick. We were in Nebraska. So after 4 or 5 years, we moved back to Kansas. I wanted to make big money. You know, I always thought I would be making $25 an hour as an RN. Yeah, no. My first job as an RN, I made $12 an hour. My first job as a CNA, mind you, I made $2.35 an hour. Crazy, huh? So when I came back to Kansas, I went to work for a temp agency because I wanted to make that $25 an hour. Well, what they didn't, explain very well was they didn't pay taxes, they had no benefits, and I could drive 2 hours to a hospital or a nursing home and not have a job. They'd send me home. So it wasn't for me and also it was one of those things where I didn't like walking into a nursing home, not knowing my residents and not knowing my aides. Because I always say, if I have good aides, I'm a good nurse. If I have bad aides, I'm a terrible nurse because I'm not helping my aides be better. So I went back to work at the nursing home where I got my CNA, and I was a charge nurse, MDS coordinator assistant. I did that for a few years, but my husband wasn't a small town guy. He grew up in Wichita, so we ended up moving to Wichita. When I came to Wichita, I specialized with 6 neurosurgeons who only operated on brain and spine. Now, I love that job. I did that job for 15 years. However, the last 3 years I was clinical manager and I didn't care for that. That wasn't my kind of job. So one day, about 4 years ago, I put my application on ZipRecruiter, and in 15 minutes, I had a call from Allied. In 2 days, I had an interview, and I was working here 3 weeks later. I really felt like it was a calling, like something I was supposed to be doing. When I started, I was doing CNA, CMA, day and evening, EKG, home health aide, social service director, CMA update, and lots. But however, we've been very blessed, and Allied has grown over the last 4 years. So there's multiple people doing everything I was doing 4 years ago. I love my job. I love Allied. I love what we stand for. And hopefully you will get something out of this class, no matter where this class leads you to. Hopefully there's something we teach you that will stick with you. I'm excited to get you started on your course. So I'm going to sign off, and I'll see you in the next video.